Hello, everybody, and welcome to our webinar. Welcome, everybody, to our webinar from our LAC Urban Health. I'm going to start sharing my screen. Okay, here we are. So again, thank you for this series of webinar, for being in this series of webinar from our LAC Urban Health. Today we're going to have a webinar around road safety in Latin American cities. This is the third webinar that we have had from our network and from our SALURBAL project. The audience for today, many of the people who are today connected are mainly from Latin America and the US, but we also have some people from Asia and Europe. Everybody very welcome. Today we're going to do this webinar in English, but in the following weeks you will also find the same webinar in Spanish. So for those who speak Spanish, para aquellos que hablan en español, tendremos este webinar en español en las próximas semanas. This is the audience that we have for today. Mostly are individuals from research and academia. We also have representatives of the government, NGOs, private sector, and students. For our webinars, it's so important to do capacity building. And before I start, I'm gonna give you just a little bit of background of our SALURBAL project. For those who are not familiar for our SALURBAL project, which is Salud Urbana in America Latina, this is a research project from our network on urban health that include 15 institutions. Our principal investigator is Ana Diaz-Rue from Drexel University. And here in this map, you see all the countries that are represented in our network and in our SALURBAL project. A little bit of background on our SALURBAL research questions. The first one is, how do urban policies impact urban built and natural environments? And today we're going to be focusing on road mortality policies, policies that prevent road mortality. Also, the second question is, how do urban built and natural environments impact urban health outcomes, disparities, and factors related to environmental sustainability? And finally, how can cities act to improve health, reduce disparities, and support environmental sustainability? So these are the general questions that we have on our SALURBAL project. And as I said, today we're going to be focusing on road mortality. We know that during this week, specifically on November 15, we had the World Day of Remembrance of Road Traffic Victims. And with our research, with our evidence, we want to promote actions that are also evidence-based to prevent road mortality. So a little bit of background on the SALURBAL data, and one of our speakers will talk more in detail about this. We have compiled information and we have harmonized database of 371 cities that have at least 100,000 people in more than 11 countries. We also have data on sub-cities, more than 1,400 sub-cities and neighborhoods within these cities. And we have indicators on deaths and causes of death. We also have indicators on the built environment. Today, we're going to be focusing more on urban form, land use, transit options, and traffic congestion. And of course, a main focus of our research in SALURBAL is regarding social equity. So to better understand some of the data for today, for this webinar on road mortality, we're going to have three speakers. First, Alex Quitzberg, who is going to talk about the city characteristics and road traffic mortality in Latin America. Is the largest evaluation we have done for Latin American cities. But then, since we understand the importance of local policies and evidence-based for our cities, Carolina will be talking about a specific evaluation on speed limits and traffic enforcement in Mexico City. And lastly, Germán Carvajal will be talking about a 7-year analysis on bicycle safety in Bogota. After these presentations, we're going to have the discussion about this research from the transport and the health perspective. From transport, we will have Dario Hidalgo. who is a senior mobility a researcher from WRI, and Carlos Dora, who is the incoming president of the International Society of Urban Health. So we will start our presentations. We will start with Alex Quistberg. So for you to know, Alex is an injury epidemiologist whose research has focused primarily on road safety, the built environment, and global health. His current research is focused on urban health issues in Latin America. He is also a SALURBAL project researcher and also an assistant research professor at Urban Collaborative at Drexel University. Welcome, Alex.
All right, thank you, Olga-Lucia, for that introduction, and thank you all for connecting and for listening in on this presentation and presentations we're having today. So as Olga-Lucia mentioned, I'm going to be presenting on some of the work that I've been working on for SALURBAL, looking at road traffic mortality across the cities in the study. I'll first just give a really brief overview of road traffic safety concepts for those who aren't familiar with those, and then we'll lead into the research that we've been working on. So as many of you likely know, road traffic injuries are a major cause of burden of disease in the region. There's about 100,000 road traffic deaths annually in Latin America. Many of those impact younger age groups. It's the first and second leading cause of death for these age groups mentioned here in the slide. And so it has this is why the burden of disease is so important, because it has lifelong impacts for those that are injured often, and for those that are fatally injured, they're taken in the prime of their life often, and resulting in major impacts and loss of potential contribution to society. So overall, there's different ways of thinking about how road traffic safety works together. This is one conceptualization that the goal is to think about are the roads safe? Are we managing user behaviors a certain way? Are we keeping people safe on the roads? Are the vehicles transiting on the road safe? And there's a number of different aspects that can feed into those different aspects of road safety, whether from research or enforcement policies. And so I'll touch on a few of these things now. The economic impact of road traffic injuries is quite large in the region. A PAHO study a couple of years ago estimated they had a 4.4% loss of GDP on the region. This is due to losing people in the prime of their life, trauma care costs, loss of employment or long-term job impacts, traffic impacts, and other things that are related with road traffic collisions. In terms of economic development, on the right, this graph is illustrating different countries at different economic levels of development, as well as different rates of road traffic mortality by road user groups. For those in the lower income range, they tend to have higher rates of pedestrian deaths, but as their economic development is higher, we see large increases in the motor vehicle occupant rates that stay as motor vehicle motorization increases in these countries. And part of this might be related to changes in traffic user behaviors. So as people are walking or biking or taking public transit less and they're taking personal vehicles, well, that's partly why we might see more increases in the motor vehicle occupant rates. In terms of the built environment, we can look at a couple of different levels. We have city level factors, neighborhood level factors, and street level factors. At the city level, the way that the city is laid out, its urban development, how different parts of the city are developing can contribute to road traffic road traffic safety risk. So a number of studies in the US have demonstrated that cities that tend to have less sprawl, that are more compact, have lower road traffic mortality rates, whereas those that are more spread out tend to have higher rates. Some of this might be related to, as we see in the figure on the right, we might have neighborhoods on the top right of that figure that have neighborhoods that are more spread out, less connected, and so people are required really to drive to get to places easily, and that creates more traffic and more opportunities for collisions to happen and for them to be fatal. Whereas in the lower left half of that figure, we see a neighborhood that tends to be more compact with more intersections and opportunities for people to get to destinations more directly, which, at least for pedestrians can be beneficial, and potentially for public transit and cyclists as well. And if we think about the street level, where people are exposed directly to elements of how streets are designed and planned, this is an example from Lima, Peru, of an intersection that this is very complex. As you can see, it has multiple lanes of different types of traffic going different ways. We have a woman with a child there trying to cross the road, who started from one corner trying to get to a corner with a bus stop. And if you imagine trying to cross this road, the number of different factors that for a pedestrian or even for a motorist coming through here that could be a risk, different cross streams of traffic, really wide road width, traffic control might be difficult to evaluate or to comply with. The intersection layout itself is very complex, and lighting might be an issue at nighttime. And so these street level factors are also really important contributors to road traffic injury risk. One factor that's probably been looked at less so in road traffic injury studies is the social environment. This is a study from Montreal that looked at census tracts by income level. And in the graph on the left, we have a unadjusted model that finds that pedestrian injury rates in the poorest areas of the city tended to be much higher per person than in the wealthiest areas of the city. But as the models were adjusted for different factors, including traffic volume, household income, intersection geometry, and pedestrian volume, as we get to the right, we can see that there's fewer differences between them. And so a lot of this social differences might be in how equitable the distribution of safe built environment features are among these different neighborhoods. And so that's something I think really important for cities to think about, and that we'll talk a little bit later. So the built-in social environment factors can influence some of the road user behaviors. One of the key ones is speeding. This graph is an illustration of how the higher the speed is, the more likely that someone that's struck by that vehicle, or another vehicle is struck by two vehicles at high speeds, the higher chance there is of a death occurring. And so speeds, there's a number of ways that these could be managed. The image on the right shows different ways that cities can implement different ways of modifying the road over a wide area to slow down speeds. There's a number of different other factors that also contribute to managing road user behaviors that I won't go into detail about, but we'll both our other presenters will talk a little bit on that in terms of their policies. So in terms of policies, there's many examples of road safety policies. I've just put a few here. Vision Zero is one of the most prominent ones over the past few years. Speed cameras are gaining popularity in many countries to control speeds. Sobriety checkpoints are known to be effective at reducing alcohol driving, and something as simple as a speed bump can also help reduce speeds and reduce road traffic injuries. And so there's a number of policies that might fit to the local context of a city that cities can consider. So I'm going to move on to the research, a presentation of my research results for what I've been doing for SALURBAL. So the research objectives for this particular study, looking at road traffic mortality across the cities in the study, was to first get an overview of the quality of the road traffic death data, and then to look at some of the epidemiological patterns by age and sex across the cities, and then to look at the association between city level built-in social environment factors with road traffic mortality. We included 366 of the cities that we had bioregistry data for. These cities were cities that had over 100,000 population from 10 countries. We defined these by using a mix of the urban development of the city with the geographic political boundaries of cities to define those. Deaths were coded and extracted from vital registry data from 2010 to 2016 and looked at cross-sectionally all together. We looked at 5-year age groups by sex and looked at a number of different factors that I'll talk about in a little bit more detail in a later follow-up slide. So when we look at the quality and distribution of road user type by country in terms of the deaths, this is the total deaths and the proportion of deaths by road user type. we can see there's substantial variation between countries. And this is something that reflects in the overall country statistics, but this is, among these specific cities that we've selected here. So the bottom bar that's in the dark blue represents pedestrians, and we can see, this ranges, very low in some countries, maybe as low as 10 to 20%, assuming that that's a correct, classification of them, up to, over 40 to 50% of all deaths in that country among those cities. But I want to draw your attention to the top bar, that's the gray bar, which are road traffic deaths, but we don't know the road user type that's been impacted by that was a victim of that type of a certain type of collision. So we don't know if those people are pedestrians or motor vehicle occupants or motorcyclists. And so this is a really important quality issue for cities and countries when they're coding road traffic deaths to be aware of, and to, I think, to improve these systems so that we can better understand patterns of what type of road users are being affected by this. So when we look at these patterns, the next two slides will show patterns by age and by sex groups. This slide looking at males by different road user groups, where we have darker bars indicates that that road user group tends to have focus more on the proportion of road user deaths is higher in the lower age groups, whereas lighter colors are for the higher age groups. So if we look at the pedestrian and bicyclist group, we can see that there tend to be a lot more older people that are a proportion of the deaths there than in the motorcyclist and car passenger groups. And the ill-defined group we see is a little bit probably in between those, and so that reflects there's probably both pedestrians and motorcyclists and other car occupants in that group that haven't been coded to those specific codes. We see similar patterns in female road user victims, but a little bit different, with the pedestrians and cyclists tending to be a higher proportion of younger age groups than we saw in the males, but fairly similar patterns, I would say, in the other age groups. And so looking at these age and sex groups is also important for city officials to think about in terms of what types of people are victims, and how to address their different needs and safety needs as they're transiting through the cities. So now moving on, the next few slides will focus on road traffic mortality rates. This graph illustrates each point being a city of the study, where we have them classified by country here, and this is showing their distribution in terms of their age standardized road traffic mortality rate per 100,000 population. So we can see, similar to what we saw, with the variation in the type of road user, that there's substantial variation in the rates within countries, but also across countries. It's one of the countries having ranges as wide as in the case of Peru, 50 deaths per 100,000 difference between cities, which is quite substantial in terms of thinking of this scale. So once again, what are the underlying factors contributing to these variations? We want to try to understand by looking at some of these city level factors that we were able to collect. This graph is really kind of a repeat of the previous slide, but showing and probably not mathematically entirely correct, but it's showing exactly how the highest and lowest city rates look like in each country. So the top cities would be the highest rates and their values, and the lowest rates cities are on the bottom here. You can see in the lowest cities, some of the largest cities in the country, some of the capital cities are represented there, perhaps because those cities have had a chance to get better established road safety systems in place as they've had much more advanced economic development than other cities in their country, perhaps. So that's something else to look at as an example, but there's also many smaller and medium-sized cities that are also in those low zero rates, as we can see from this graph. In terms of mortality rates per age group, this is showing different patterns by country, by sex. Essentially, there's two patterns we kind of see here. We tend to see a little bit of a hump increase in road traffic mortality rates in the younger age groups that peaks, starting around 15 to 20 years and peaking, in the late 20s, and then going down to a low rate in the 40-year age range, and then increasing again in the older age range, getting above 60 years. And this is a pattern you can kind of see is very consistent across here. And so this, looking more specifically at road user groups might tell us more about where these patterns are occurring, if they're among more pedestrians or road or motor vehicle occupants or motorcyclists. So in our multivariable regression analysis, these are some of the factors that we examined in those models. So we looked at population factors, we looked at economic factors, we looked at urban development and street network factors, as well as some transportation factors. The last one, just I should say more clearly, is a measure of congestion essentially in the cities that that estimates the amount of delay in the city. In our regression analysis results, overall we found that cities that tend to have a lower traffic mortality rate were those that had higher population densities, higher annual GDPs, higher intersection densities, longer street length averages, and the presence of a mass transit system like a BRT or subway. Whereas cities that had much higher rates of road traffic mortality were those that had higher population growth during the time period, that had more isolated urban development areas, and those that had more complicated intersections, so more streets per intersection. And we didn't see an association, at least in this analysis, with the congestion measure or with the social environment index that we had created. So overall, just to conclude, we feel that these results, can tell urban planners and traffic engineers important ways to manage urban development and city level planning in terms of thinking about how street connectivity, population density, and urban development fragmentation is increasing. And so thinking about those things maybe can help cities improve and reduce road traffic mortality rates. Also, like having mass transit systems seems to be beneficial. This is something that I think that helps move people from more risky forms of transportation in terms of personal motor vehicle use into something that's safer for all road users. And so we suggest future road safety work in the region could focus on specific policies. Some examples we'll have today, as well as subgroups like pedestrians and motorcyclists, and perhaps smaller geographic areas within cities to look at neighborhood differences within cities. Because overall, we've seen a lot of heterogeneity in these results, and we believe it's important to look beyond just the big cities in the countries to look at also smaller and middle-sized cities, as well as different differences among neighborhoods and cities. So thank you. That's I have today, and this is to thank the collaborators from the SALURBAL in this project who've contributed to this.
Thank you, Alex, for this big overview of Latin America and that shows all these factors associated with road mortality in a very heterogeneous region. So now, after going through all this data from the Latin American cities, we're gonna go to a specific case and a policy analysis. So Carolina is gonna present that case from Mexico City. Carolina Perez is a researcher at the Instituto Nacional de Salud Pública in Mexico. She's a social epidemiologist studying urban health, specifically the urban food environment and road safety, as well as obesity and its social distribution. She is the lead researcher of a SALURBAL study evaluating reduction of speed limits and enhancement of speed limit enforcement implemented as part of the country's Vision Zero strategy in Mexico City in order to better understand the impacts of the policy. And that's what it's about, her presentation. Welcome, Carolina. And for all the audience, please send us your questions, comments, as Andrea said, in English, Spanish, or Portuguese.
Good morning, everybody, and thank you very much for the introduction and the invitation to present in this webinar. As Olga Lucia mentioned, I will be presenting some results of our evaluation of speed limits and increased enforcement of speed limits in Mexico City. I would first like to acknowledge the team that has been working on this project. We're from the National Institute of Public Health, from the National University in Mexico, and from Drexel University. funded by SALURBAL and Wellcome Trust. So I will jump straight into the information for Mexico City. So as you saw from Dr. Quisberg's presentation, Mexico City has one of the lowest mortality rates within Mexico, although it's still very high compared to other cities in higher income countries. So just to give you an idea, in 2015, and I'm talking about 2015 because the intervention that I'll be evaluating happened in that year, there were on average 15 deaths per week due to road traffic collisions. And that works out to a mortality rate of about 8.7 per 100,000. So because of this very high number of deaths in the city, the mayor of Mexico City in 2015 adopted Vision Zero, which is a strategy that started in Sweden that has as a premise three things. One, that all road traffic deaths are unacceptable. Two, that humans make mistakes. And three, that the road system has therefore has to be designed to protect individuals. So one of the ways in which this Vision Zero strategy was operationalized or taken down to the streets was with new road traffic regulations that came into effect in December 15, 2015. So these new road traffic regulations had two new things. One were lower speed limits and the introduction of speed radars, new speed radars, and higher fines for speeding vehicles. And the second was the installation of this automatic enforcement devices to detect 9 motoring offenses, which were not using a seatbelt, prohibited turns, invasion of bus rapid transit lane, invasion of cycle lane, wrong way driving, invasion of zebra crossings, not stopping at red lights, using distractors like cell phones, and driving with children on front seats. So there were 66 new enforcement devices installed across the city, which were linked to the new fines. And in this map, you can see their location. So the red squares are the devices that detect the 9 motoring offenses that I was talking about, and the blue triangles are the speed radars. And as you can see, they're mostly, well, they are spread out across the city, but there are some municipalities, which are the borders that you see in this map, that do not have any devices. And this is important to mention because when I show you the results of our evaluation, we will be comparing municipalities that have some devices versus those that don't have any devices. So just very briefly, what the evidence on speed limits and enforcement devices, as Alex has already mentioned in his presentation, speed management interventions are one of the most effective interventions to reduce the number of injured and dead. And furthermore, the use of cameras for detecting speeding and other motoring offenses have been associated with a reduction of 19% of all crashes and 25% of crashes that result in injury or fatalities. And this comes from a systematic review of studies conducted across the globe. So although there is quite a lot of evidence about the effectiveness of these policies, in Mexico City, these interventions were very unpopular with drivers and were never formally evaluated. So there was a suspension of the economic fines associated with these motoring offenses in early 2019. So our objective for this study was to estimate the effect of the road traffic regulations as a package that were implemented in 2015 in the city on police-reported collisions which result in injury, and mortality from road traffic collisions. And our hypothesis was that these three outcomes, that we would see a decline in the three outcomes. So a decline in total collisions resulting in injury and mortality after December 2015, and that we would see a larger decline in municipalities that have enforcement devices compared to municipalities where there are no enforcement devices. So very briefly, we use data from police-reported collisions and also on the number of registered vehicles as an offset. We use data on from the vital registry for the mortality, and we use the total population projections prepared by a population council in Mexico to compute mortality rates. And what we have is weekly collisions and mortality counts from January 2013 to December 2018. So we have data for a period of 3 years before the intervention and data for 3 years after the intervention. And what we did in our analysis was to compare trends before and after the intervention. So very schematically on the diagram to the right, you can see that what we wanted to see was whether the trends of the 3 outcomes changed after the intervention, which is illustrated with a dotted line in December 2015. So I'll show you some results now. This diagram shows the trend for total collisions, and these every blue dot is the rate, the weekly rate per 100,000 vehicles. And as I said, the trend starts in January 2013 and finishes in December 2018. And what you can see here is that there was a declining trend in the total number of collisions since before the intervention came into effect. And the intervention is, you can see the vertical line here in December 2015. And unexpectedly, what we see here is that there was a slight increase or a flattening of this decline from the intervention onwards. So an increase of 0.2% per week after the intervention. We see a very similar picture for collisions resulting in injury, also a flattening of the curve of this trend that was coming from 2013. However, when we compare the trends for municipalities that have these speed cameras and photomulta devices, which are the ones that detect benign motoring offenses, we see that those municipalities that had devices did better than those that did not have devices. So in this graph, you can see that the trend at the top with the orange or the purple dots, those are that's the trend in the municipalities that have cameras. And the trend at the bottom with the blue dots is a trend in the municipalities that do not have devices. And you can see an increase in the number of collisions in municipalities that did not have any devices. And we see again a similar picture for collisions resulting in injury. Now I'm going to show you the results for the mortality rate. And for mortality, and if you remember, this is a different data set. This is mortality information that comes from the vital registry. And for mortality, we see a clear decline starting in the intervention point of 0.2% per week after the intervention. So that the trend changes 0.2% per week after the intervention. And this works out to be about a decline of 10% per year, which is a very large decline. So just to sum up, what we saw was that the package of interventions, so the new road traffic regulations that came into effect in December 2015, had an effect on mortality at the city level with a decrease of 0.2% per week after the intervention. However, the effect on police reported collisions was not entirely as expected. And we are looking into explanations for this, and we have two potential hypotheses. One is that it is true that there were more collisions. However, these collisions were less severe because they happened at lower speeds. So we see a decline in mortality. The other potential explanation is that there was increased police activity. So as a result of the new regulations and the announcement of Vision Zero, the police activity might have increased. So there were more collisions being reported and registered. We know that only a small proportion of collisions actually gets reported by the police. But having said that, so we will be looking into these potential explanations. So, for example, one of the things that we will be doing is using other data sets, and we have already been working with data from insurance companies, which is completely independent of any police activity, to see whether the trends are consistent or not. However, even with these two hypotheses, what we did see with our data from police reported collisions is that municipalities that did not have automated traffic enforcement devices experienced larger increases in collisions compared to municipalities with devices. So municipalities with devices did better than those that did not have any devices. So I'll leave it here. And I'll hand over to Germán Carvajal, my colleague from Colombia, and I'll be very happy to take any questions later on. Thank you.
Thank you so much, Carolina, for this policy evaluation from one of the largest city in Latin America that not necessarily always show the same trends that we see in high-income countries. And that's going to be part of the discussion after these presentations. So now we move towards South America, to Colombia. And for this city, we have an evaluation that Germán will be presented. Germán Carvajal is an industrial engineering and an economist in the SALURBAL project. He is a data scientist that works on machine learning, optimization, and probabilistic mathematical modeling. He, as I said, is a researcher collaborating in the SALURBAL project and is also an adjunct professor at Universidad de los Andes in Bogota. Welcome, Germán.
Thank you, Lucia. Thank you, Carolina, for the introduction, and thanks everyone for joining us today. I'm going to share the screen. I'll be presenting you a thorough analysis to understand bicyclist mortality in the city. This is entitled Bicycle Safety in Bogota, a 7-year analysis of bicyclist collisions and fatalities. First, I'd like to present the research team. It is composed of an interdisciplinary group of researchers of SALURBAL across Colombia and the United States. It includes experts in public health, operations research, transportation, and also safety. This is the agenda I have prepared for today. First, I'd like to start with some context for the city of Bogota, then continue with the status and concerns of bicycling in the city. From that, we'll move on to the research questions, data sources, the main results of the analysis, and the policy recommendations we can derive from the results. So first, the context of Bogota. It is a large city with more than 7 million people that make 17 million trips per day. Yet, only 5% of those trips are on bicycle. This is despite being the city with the largest network of dedicated bicycle pathways in Latin America. Bogota has over 500 kilometers of dedicated bicycle infrastructure that increases to over 600 kilometers during the Sunday ciclovia. Moreover, since 2016, the city has developed a comprehensive framework of public policies to support safe bicycling, including the addition to the Vision Zero program and the enforcement of reduced speed limits. Nowadays, as I said, the city has a very comprehensive set of policies with a multi-sectoral perspective, including the transportation, sports and recreation, education, and health sectors. The main policies are the Ley Pro Bici, which is a Colombia-wide policy, Al Colegio en Bici, Vision Zero, the Sunday Ciclovia, and the most ambitious policy right now is the Plan Bici, which aims at making Bogota the world's bicyclist capital in the year 2038. The city plans to achieve this by implementing a large network of dedicated infrastructure under the premise, build it and they will come. But what is the status of bicycling in the city? Bicycling has proven benefits but there are multiple concerns and barriers to bicycling. One of the most important is the risk and the safety concerns of users, particularly in middle-income countries. This is supported by data. So first, more than half of all road users, all road deaths are among vulnerable road users, including bicyclists. In middle-income countries, road collisions are the leading cause of death for children and young adults. And in 2016, in Colombia, collisions were the leading cause of mortality for men, for women, and the second leading cause for men. Additionally, during the last decade, the Public Transportation Authority has reported an increase in the frequency of bicycle fatalities. And nowadays, this is under the light of the public opinion and is creating a very big concern. What you're seeing on the right of the screen is the evolution of the stock of the registered bicycle collisions in the city. The red dots are the fatalities. As you can see, it's increasing very rapidly since 2011. Using that context, the aim of the projects are to first analyze temporal trends in bicyclist mortality and non-fatal collision rates. Second, to identify areas within the city where there is a high risk for bicyclist mortality. And third, to determine the individual and contextual risk factors associated with bicyclist mortality. To fulfill our aims, we use data from the official records, which is called the Secretaría de Movilidad, and complemented the information with two independent NGOs. After cleaning the database, we have a sample short of 10,000 observations with 358 fatal collisions. For Bogotá, mortality has a very specific definition that must be taken into account. And we focused the study on the differences between fatal and non-fatal collisions, since the fatal collisions are subject to a stricter control for registry. In order to have appropriate exposure controls, we use 5 official and publicly available sources of information. From this, we computed the bicyclist population and the total number of daily trips. Finally, using the shortest bicycle paths, we computed the daily vehicle kilometers traveled. These two are the main exposure measures used in transportation and safety analysis. Now let me head to the results. During the 7-year period there were significant changes in the rates of fatal and non-fatal collisions in the city. There was a 55% reduction in non-fatal collisions and a 46% reduction in fatal collisions. We have seen that this trend continues towards 2019. But the most relevant part of the results is that we found that these reductions differ by sex. For non-fatal collisions, there was a 30% reduction in non-fatal collision rates for women, while it was over 58% for men. And most importantly, there was a 53% reduction in fatal collision rates for men, and there was no change for women, meaning their mortality rate for women has been stable during this 7-year period. On the identification of higher risk locations, we found 7 areas that have a fatality rate occurrence higher than their surroundings. They are mostly concentrated along main avenues and on areas with the lack of adequate bicycle infrastructure. These areas are distributed across all income levels in the city. Each low and middle income countries in middle income locations with 3 locations and 1 location in a high income area. On the analysis of factors associated with fatal events, we found that fatal bicyclist collisions are more likely with bicyclists more than 40 years old, at range slope higher than 3%, moderate to bad road conditions, and a nighttime hour of occurrence after 20 hours and before 4 hours in the morning. Among the factors also associated with a reduced probability of fatality are mid-size lane widths, a reduced average speed, and narrow roads with a small number of lanes. These three characteristics create a safer environment for bicyclists in the city of Bogota in terms of infrastructure. Just like in the rate trait analysis, we found significant differences in the factors associated across sexes. For example, men can stand terrain slopes up to 3%. After this threshold, it becomes more riskier for them, while for women, this threshold is lower, it's only 2.5%. Also, there are differences in the effects of the vehicle type they crash into. For example, for women, crashing into a cargo vehicle is over three times as more riskier than crashing into an automobile, while for men it is only around 9 times. One key finding of our analysis is that our results indicate that the presence of bicycle pathways does in fact reduce the risk of a fatal collision. It reduces by 80% the probability of a fatal collision compared to roads with no presence of a bicycle pathway. With those results, this 7-year analysis shows that both fatal and non-fatal bicycling collision rates have decreased during the period, but that this reduction differs by sex. Most importantly, there has been no reduction in the fatal collision rates for women. We identified intra-city variations in the mortality risks. Also, we identified factors positively and negatively associated with the risk of a fatal collision, and show that the factors themselves and their effects also differ by sex. The results have significant policy implications. Thus, we recommend continue building and enhancing safe bicycle infrastructure. Second, we recommend separating bicycle infrastructure and bicyclists from avenues and roads with large vehicles. Continue the law enforcement of reduced speed limits. Prioritize geographical areas that could be intervened in the city. And finally, design a public policy guideline with a gender and equality focus. Our methodology is based on open data, so it's also very efficient and can be used by other cities in Latin America as a monitoring tool for checking on bicycling safety status. For more information, I invite you to read the paper, which is published on accident analysis and prevention. Thank you very much.
Thank you, Herman, for this presentation on road mortality, but among bicyclists. So now I'm going to invite our discussants, Dario Hidalgo and Carlos Dora. Dario Hidalgo holds a PhD and a master's degree in transportation planning from Ohio State University and a civil engineering degree from Universidad de los Andes in Colombia. He has more than 30 years of experience as transport expert, consultant, and government official. Dario Hidalgo has been part of WRI for 11 years, where he holds with WRI Road Center for Sustainable Cities International team of transport engineers and planners. Welcome, Dario. And Carlos Dora, our second discussant from the public health perspective, is a medical doctor and an epidemiologist with a master's and PhD from the London School of Hygiene and Tropical Medicine. He has worked in internal medicine, in postgraduate medical training, and in organizations of local preventive and healthcare services in Brazil and the United Kingdom. He also served as a senior policy analyst for at WHO, Director General Office, and he has led assessments of the evidence of transport and health links, has analyzed economic and policy implications of not taking health into account of those policies, including how the situation may be improved by the international law. He is currently the incoming president of our great society, the International Society of Urban Health, which I recommend all of you to join. And also, Carlos, welcome. So we're going to have this health perspective and transport perspective. And as many of you have seen, analyzing these policies, analyzing these harmonized data really requires the views from different disciplines. Welcome.
Thank you. Shall we start with the comments? Well,
Go ahead, Carlos.
Thank you. For the initiative, I mean, for the whole research project, we have to think welcome again as well. But I think it's great that you are having this broad focus on public policies, health impacts, but also impacts on sustainability and environment. And you're looking ultimately at finding conclusions at how cities, what they can do to improve health, to reduce inequality, and to improve the environment circumstances. So I think the focus, congratulations on the focus, I think is absolutely spot on. And thank you for also the focus on traffic injuries and cycling, because that's been, having worked in transportation and health and sustainability for many years, I see, and we've been advocating for cycling, and our main concern is exactly traffic injuries, because we know that cycling improves the air quality, provides physical activity, provides a number of social connections, but the big question is the traffic injuries. And I think what you're presenting in sequence is a very interesting, has a logic, obviously, but also, and I think I would stress that, has the limitations of very aggregate data to get to conclusions which are relevant to the local level, because the local circumstances, as you're showing the Bogota case, are so important. And when you start looking at the big picture of Latin America, I think what you really legitimately can conclude is, that there are very big differences between cities. I mean, the fact that a city, Juliaca in Peru, is 20 times have mortality rate of the city in Barranquilla in Colombia. I mean, that's striking in itself. I do think that the associations with the built environment that you're able to do with whatever data that exist in an aggregate data in Latin America are evidently insufficient. And I think they don't lend themselves to many recommendations, I would say, that could be used by a local level. So I would stress the importance in terms of the conclusions and the narratives that you're getting out of this. And that's my focus. What narratives do you have out of these three pieces? And how is it that you can establish a conversation with people with civil society, local governments, et cetera, to bring their attention to the issue and to find solutions? I'll stress just the big facts. The big facts is cyclists and pedestrians have much higher mortality rates per kilometer driven or ridden. So I think that's in itself an issue of equity and fairness, which is a very important issue, it's a healthy issue. I would stress the big differences between cities, but I wouldn't go, my sense, very much on what specific. I mean, is it a more compact city better or not? Also because the difference that you're finding are not that big. And you have all sorts of confounding factors which are not considered. So I'll be guarded there in terms of the narratives that you produce. And I would also include things which are not there in either of the three, and you must have good reasons for that. Why you don't have alcohol, why you don't have helmets. I think if you're coming from anywhere, of course, I haven't been part of your conversations, and you must have very good reasons for doing that. But I would stress that in the narrative, what is the relative role of individual factors like alcohol? I mean, you have some of the speed measures, not all that you would want to have, but I think those things are high level and they are very important that you include in the conversations. If not, the first thing that people would ask you, well, why didn't you ask, what about alcohol and what about helmets? And so I think I would reflect on establishing those conversations and what are the questions which are going to come back to you, and then establish that. For the Mexico, I think it's fascinating, question. Why is it that the government coming in 2019 and did all this, enforcement measures? And of course, some of us know why, those of us who travel to Mexico regularly and who's made the decision. But I think the idea of trying to evaluate retrospectively is a very valid idea, very important. Now, I think we didn't, of course, you had, there's a number of questions which remain to be asked around confounding factors, which are important. And you're dealing with aggregate data, so I can completely understand your limitations. But maybe some of the narrative that you could also introduce to make the point is that you've had a reduction in trends in injuries since before the legislation in December 2019, 2015. So if there was a decreasing trend before, you didn't, in the slide presentation, you may have written that. But I think that's a very legitimate question. And what was happening in Mexico City before that was leading to that? And why is it at that moment, some of the additional measures were brought in? And so I think that picture, I mean, I know that there were BRTs being introduced. There was, you have an excellent metro system, but there were new things in the public transportation which were being introduced. So I would certainly look at those trends. I think it'll be an important part of your narrative. And I would also try to describe to what extent that if the intervention was effective in terms of, did it reduce average speeds in those areas or not? And did it lead to, was the enforcement actually happening? I know that in 2019, they decided that there wouldn't be any more enforcement, but was that, to what extent was it actually changed some behaviors? I mean, if you can get those pieces of information, it will be important, I think, to construct a narrative. I think one piece of it is what you have in Bogota. You also, the Bogota, of course, you have the chance of looking much more detailed information. And I warmly congratulate you. I think you have great analysis. And I think it was really exciting to be able to also read the paper in addition to the slide presentation. Again, I would bring talking narratives. We all know that you had a BRT system for longer. You're one of the first after Curitiba to introduce the BRT. We know, or some of us know, that there wasn't any notice taken to cyclists and pedestrians in the initial phase. All that transition of moving from BRT only to BRT plus cycling and walking, it's a very important part of the story. Also, when you're doing in the paper, you're comparing with Germany, you've done much better than Germany. One of the, those macro factors that, explain why you've done much better than Germany. I think those, I know you go more into the specific analysis, but those big pieces of the story are really important for people to grasp, understand, and to be able to use. And my last point, because I don't know where I am in my time, is that having all this data available to people and being open source, I think is absolutely fantastic. Now, that comes with how is it that you could be stimulating citizen science? And I don't know if the SALURBAL program has a part to do with citizen science. I have some experience in air pollution in cities with citizen science, which actually is the use of portable equipment, films, pictures, to help generate stories and narratives and help argue things and sort of engage more in the political and decision-making, empower people at the local level to do things. So I think you have superb material there to be able to engage with some of that. So those are questions to you. How much citizen science you think could be, are civil society organizations engaged with you on that? But I think that opens a very exciting research policy agenda for cities. And really congratulations, because you have beautiful work done in Bogota, but also in this piece of work, which is so important. Thank you.
Thank you so much for those very insightful comments, Carlos. And now I give the word to Darío from the transport sector to complement those.
Well, I have just how important, I just want to indicate how important these approaches have been in supporting our activity in influencing government to make the right decisions. The perspective from public health, especially the road safety perspective, it's incredibly powerful in improving quality and the performance of the policy in the case of Bogota and other places in the region. So I am really, really happy to see the evidence from Alex and the team in SALURBAL that is showing that there are things that are not necessarily meant for public health, but have so much influence in saving lives and reducing fatal injuries. And the report shows that, Alex, and I'm very impressed, things like density and income and other, even though it's aggregate data, there's some influence, and you can continue arguing if you have a compact city, if you have more facilities for walking and cycling, if you improve the access for women to jobs and circulation, you start having public health outcomes that are positive, not just the normal thing that we talk in transportation. We are so much about reducing travel time, but not much about reducing traffic deaths. And this discussion is still ongoing. I have colleagues in the field that still believe that the highway capacity manual is the only thing you should work with. But we know that that increasing capacity and increasing speed, it's bringing really, really bad impacts in terms of quality of life, but also in terms of road safety. So I'm very impressed with the Carolina's work in Mexico, and I just wanted to show fast one is a couple of slides, one from Bogota that has to do with these, but in the case of Bogota. And it's a big a reduction that Bogota has experienced with the speed reduction and improved enforcement. Bogota started with 10 corridors that the speed was reduced to 50 kilometers an hour, like it was in Mexico, and also improving enforcement. And the comparison is 38% reduction in road fatalities. You show the evidence from before the application of these measures in Mexico City, but Bogota is showing that these speed reductions and camera enforcement work. We unfortunately have some problems with camera enforcement right now. The legal system behind it is not in place anymore. We are not able to use the speed cameras as we were supposed to. We expect that it will be improved soon, because the speed cameras can be the best thing to reduce fatalities and really make these speed reductions the people complying to. And just one mention, I don't know what is the case in Mexico City, but measurements in Bogota show that only 20% of drivers exceed speed. It's not all. We usually say, oh, there's a lot of people that exceed the speed, but in the case of Bogota, compliance with the speed is for the majority. We need the control on that minority. Probably you need to see that also in Mexico. And in regard with the cycling paper by the team that Herman presented, I was totally impressed with looking that you were able to show that safety by numbers works. Bogota has increased a lot the number of cyclists and the number of bike kilometers, and you show in your graphs that the crashes are reducing, and also the deaths are reducing, and that there are differences between men and women. This gender perspective is not that common, and I really congratulate the team for taking that time to look into gender differences. And as Herman said, this continued till 2019. There has been a continuous decrease, not as steep as it was before, probably because we have more people cycling that is also in the delivery service, and that we need to look at that very particularly because that has increased a lot. But it was impressive to see that the rates decreased for women and not for men in the period between your study and 2019 with the data of the last survey of origin and destination. And during this time, we're seeing a very different picture because of the pandemic. And in the case of Bogota, a reduction of 28% in road deaths during this year compared to 2019. But in the case of cyclists, we have been seeing an increase. We have more cyclists dead in 2020 than we had in the same period of 2019. And I may say that speed has increased. We need to look carefully at the data, but speed has increased and also a big spike in bike use. So probably safety by numbers, we need to look at the evidence. Safety by numbers is still working, and that's one of the reasons that we are seeing an increase in the number of cyclists dead, but probably if you divide by cyclists or by bicycle kilometers, you see a big decline, as you saw in your paper. Those were my comments so far. And I just want you to comment to continue to do the research. There are many questions that are unanswered, and it's very good. Carlos pointed at some of them, but in the case of the region, we see, for instance, increase in motorcycling. We need to look at that carefully, and also the case that pedestrians are there. So I know you are doing some work on that area, and I will be happy to look at the results of that and continue trying to influence policy with it. Thank you.
Thank you, Dario. Thank you, Carlos, for this great discussion and for bringing different perspectives to the results that we have here. So now I'm going to invite all the speakers and also discussants, because we have several questions, and also you brought some questions. Carlos asked questions to Alex, Dario, and also asked questions to Alex, Carolina, and Germán. So I'm going to start with one question to you, Alex, and you can also elaborate with the questions that Carlos and Dario ask you. So one of the questions from our audience, Alex, and it's something that we are always worried about when we deal with data, is how did you deal with issues of underreporting and different death definitions in the cities? And did you link police and health data to get more robust data set on each city? So for you, Alex.
Yeah. Thank you for that question. It's it's a very important question. The underlying data is so key to the conclusions we can make, right? And so for this analysis, we looked at vital registry data rather than police data linked to health records. So in terms of vital registry data, it should be as complete as it can be in terms of recording a death. Though we do know that a number of our countries have under registration of deaths. And so in the analysis, we did account for those using a number of demographic techniques. And another issue related to that, it's kind of was shown in one of the slides, is the ill-defined deaths, not only among road traffic victims, but also overall in those deaths from external causes or other causes. And so we did execute a redistribution of deaths that were ill-defined, among the specific cause codes that they were relevant to. And we did that in a way of a multiplication approach, so that we repeated the analysis 100 times to try to account for those redistributions. And those results are reflected in those regression analyses that I shared. But yeah, it's very, so looking at police data, that's, it's a whole other different issue where, for special mortality, like they might not capture deaths that happen after the fact, deaths that happen in the hospital or on the way to the hospital. We know from some studies that might be 50% of deaths that aren't captured in police data. So I think I'll leave that there and move on to the next question.
Thank you, Alex. And I think adding to that, we have problems with the data. This is the first time that we harmonize a data this big. So part of all the recommendations from SALURBAL, and it will be good if you spread the word, Dario, and also from our society, Carlos, is that part of these studies are showing that we have limitations. So in our countries, we need to improve the quality of our data. But at the same time, that doesn't mean that we cannot analyze the data. So that's also part of the message that we have from SALURBAL, because we have to provide data and evidence for our region. So the next question for Carolina, they ask you, is there any information about what happened in 2013 where the decrease started? And could it be that municipalities not having devices are influencing those having speed devices in terms of collisions? And by changing traffic volumes to non-controlled roads, is this the case? And they ask you, is this the case? I mean, these are some hypotheses from the person who asked the question.
Thank you for this question. In terms of what happened before the intervention, we know that there's been a history of interventions happening in Mexico City. So there was a Programa Acción Específico para la Seguridad Vial, a big Mexican strategy for road safety. We've had alcohol checkpoints installed for many years, improvements to the roads. So obviously that has had an effect on mortality. And but as I said, it's still the mortality rate for Mexico City is higher than it should be. Just if you imagine 15 deaths per week on average is too much, no? So that's the history of why we see these declines, and we see these declines with all the data sets that we've looked into. In terms of this second question about whether vehicles take other routes to avoid devices, unfortunately, I cannot answer. We've looked into instead of using the vehicle registration as an offset for accidents or for collisions, using the vehicle flows in the main avenues. The problem is that the monitors to monitor vehicle flow were installed more or less at the same time as the speed cameras. So we don't have a pre-intervention period, so we can't really see whether this happened, no? Whether vehicles are taking other routes. The same, I think Carlos asked about whether speeds had declined after the introduction of the devices and with the new regulations. And unfortunately, these monitors that measure speed were also installed more or less at the same time as the devices to enforce speed limits. So we don't have a proper before measurement either for vehicle flows or for speeds. And I just wanted to clarify, I saw one question here in the chat that said whether if rules did not apply to municipalities that do not have radars. And no, they do apply. I mean, the regulations are for the entire city. The only thing that those municipalities don't have is the cameras, the devices that are monitoring automatically whether a car is speeding or a car is turning or invading the wrong lane. So it does apply for the entire city, the regulations. The only thing that's not there are the cameras. Okay, just wanted to clarify that.
Thank you, Carolina. And so here we have another question. This is for Germán. They ask you if you have any indication or any evaluation on the bike sharing programs, which are the bicicletas compartidas, and if they had an impact on accident mortality rates. And for example, might these rates be affected when new stations or more shared bicycles are introduced and the number of less experienced riders on the street increases? So I don't know if you have any comments on the bike sharing programs and how that will affect this evaluation.
Okay, we did not look specifically at ride sharing programs, but we included an analysis using the age of the vehicle, of the bicycle, as a proxy for the time the bicyclist has been riding, meaning their experience. We found that more experience is associated with less risk of a fatal bicyclist collision. So I think having those results, we can deduce that the introduction of bike sharing programs that promote bicycle sharing among new bicyclists does affect bicyclist mortality. And there should be policies to promote safety for them and protect them from the risks they're facing.
Thank you, Herman. And Carlos has a question to all of you. Why didn't we include alcohol and helmet use? Because I think we had that discussion. So I don't know if Alex, Carolina, Herman want to answer that question.
I'll take a first,
Go ahead, Alex.
Yeah. Yeah, I mean, I think I agree. Those individual behaviors are, very important underlying factors in some of the outcomes that we're seeing, right? In terms of vital registry data, unfortunately, it doesn't capture those types of behaviors. So I think individual studies that would capture those would be one way of doing that. Police data might capture some of that. We know that some police data does capture alcohol use. It might not be, completely, the quality of those data might be questionable also. But I think that's one way we can go for that. We are doing some studies evaluating alcohol control policies in some of the cities in SALURBAL. And in terms of bike helmet use, I think that's really requires an observational study, where we go on the ground and observe those or follow people, or hospital related studies, looking at people who are cyclists that are injured that come in, and we ascertain their bicycle helmet use is another way of doing that. And as far as I know, I don't think studies like that have been done in the regions. I think there's a lot of opportunity for people to look at those approaches and to evaluate what those look like, what those outcomes look like. But yeah, I agree. There's tons of these individual user factors that we haven't looked at, and that can also tell us about the effectiveness of the policies.
Thank you, Alex. And I think Dario wants to comment about that. Go ahead, Dario, please.
Oh, it's difficult to get the data, but there are a couple of, there's a series of data collection colleagues from Johns Hopkins are doing in Fortaleza, Sao Paulo, and Bogota, and may expand to others with Bloomberg funding. So probably this data on alcohol and helmets may improve across the region with these very, very local studies on prevalence of use and these things. But in the case of Bogota, this shows that alcohol is no longer an issue, which is, it's interesting because it's a long way of public policy around alcohol. It's less than 1% of drivers under the influence, it's 0.5%. It's in the measurement error. And helmets for motorcyclists are also well used. The problem is the quality of the helmets. But yes, including this data would be very interesting.
Thank you, Dario. And Carlos also asked you questions, Alex, regarding the heterogeneity of our data and how we are having this hypothesis and those arguments and those conclusions that we have in our paper. I don't know if you want to comment on that, Alex.
Yeah, no, I think that's a really important comment in thinking about what can we do about these findings that we have, right? I mean, I think one of the questions also that one of the attendees had was, like, what do cities do that, we can't change intersection density very easily, right? Or things like that. And I think, maybe in newer developments around the cities or informal settlements, they're going up, there's things that maybe that could be done there. And there's, certainly a lot of potential risk in those areas that we could think about for managing that. But overall, I think, there might be some indication, from these factors of like, well, these cities have these lower rates, but are these city level factors, are they supporting the implementation of policies somehow, or the enforcement of policies, or other things that might be underlying associated with these city level factors. I think another thing too is there's something about the structure of the city itself that could be said that influences overall transportation in the city, and that has this more distal effect on road traffic safety that we might be seeing here as well. Some of those studies that I think I showed earlier on about the sprawl, that might be something similar happening in Latin American cities that might be a different context than the sprawl, but might also be having these overall effects. And so, what can policy or urban planner folks do about that? Is looking at where new developments are coming up in the city, or thinking about for the older established parts, what can we do to make those roads safer? Can we make areas denser, make it easier for people to not have to rely on personal motor vehicle transport? I know in some cities and in some other countries, motor taxi use is something that's increasing quite rapidly, and that could also have longer term impacts, you know, if people are substituting walking or public transit use for those. So I think there's things like that that we can think of in terms of like where we identify cities that have these certain profiles or characteristics and say, well, these among these cities, these are the successful, you know, road safety stuff, you know, other ones aren't. And so maybe among those different profiles, we need different solutions for those cities to address their specific road traffic injury risks. I guess that's kind of my off the cuff thought.
No, thank you. And I think as a region, Latin America, we recognize that it's very heterogeneous, but we also want from SALURBAL to bring that heterogeneity, because I mean, you see heterogeneity across countries, but you see a lot of heterogeneity within the countries, and that's also something that it's very clear and visible in our SALURBAL data. But we are also seeing patterns which are very interesting with our BRT, with the innovation that we see in Latin America that only through SALURBAL has been studied for the first time. So
Cable cars, Olga Lucia.
Or cable cars, that's the other one. So I was gonna later on for that presentation, but the other question that Carlos asked to Carolina was if you thought about other confounders, other variables that you would like to study in the future that could explain some of these trends that you're seeing, Caro.
Yes, thank you. And I think there was another question about that also in that chat about heterogeneity across municipalities and whether we can compare across them or not, because of course, the placement of the devices was not random. No, they were placed in areas that already had high rates of collisions. So I think just a short answer, it's a bit technical, but it's about the analysis that we're doing. So that we're doing an interrupted time series analysis or controlled interrupted time series analysis when we're comparing different municipalities. And because we're comparing the trend after the intervention with the trend before the intervention, and also the difference between control and intervention of those trends. And what this type of analysis does is that it controls for confounders that do not vary over time. So, but there is one thing that has to happen, and is that the trends pre-intervention must be parallel. And if you saw, even though the control municipalities in our case have a much higher rate of collisions and also of mortality, you can see the line is above, you know, they're not at the same level, no, they're separate. The trends are very, very similar pre-intervention, and so that means that we can compare what happens after the intervention with more or less certainty. Having said that, we are exploring different methods, that there are other methods to ensure that we're really making a fair comparison between intervention and control municipalities. So yeah, we were definitely very conscious of that heterogeneity. And yeah, I think in terms of other confounding variables, we've thought a lot about the policies, no, and about how we can best evaluate. I mean, originally we wanted to focus specifically on speed limits and speeding, but that it was very difficult to untangle the speed limits and the enforcement for speed limits from this other intervention, which happened at the same time with the other devices to monitor the motoring offenses. So at the moment I've presented the information for this package of interventions. However, we do have some data at the road level, which so we want to compare roads with a speed camera versus roads without a speed camera, which are matched on a number of characteristics. But that's a next step analysis.
Thank you, Carolina. And I think Carolina brought something that it's really interesting and that we're dealing with in SALURBAL, our second aim, which is the evaluation of these policies. And these policies are messy. Nothing is controlled. It's out of the randomized control trials that we were taught when we were training epidemiology. So what we're trying to do in SALURBAL with innovative methods is how to apply methods to understand these messiness, because that's the real life. So using very sophisticated methods, but also understanding the limitation is part of what we do, because we need to evaluate more of the policies out of the health sector to see to what extent they have a health impact in a region. So that's something that it's very much part of our SALURBAL project. So we only have 3 minutes. So any additional comments from our discussants, our presenters? A final sentence from our 2 discussants, from Dario and Carlos, who want to wrap up. One sentence of what you learned from this
Well,
webinar from Dario, and 1 sentence from Carlos.
Oh, keep it going. Keep this research, bringing young researchers to the table to analyze data, to use new methods and find these recommendations that are so useful for policy, that we are using strongly to recommend policy, and some have influenced policy. It's not that we just do the research work. We have been able to influence some policy, so keep it up. I was very impressed with the reduction in the slope after in Mexico City. I just wonder if that was significant because of the big dispersion before and after. But Vision Zero is about reducing mortality, not reducing crashes. So that was a very strong result, and I hope it keeps up with the discussion that we have in Mexico City, because we are not there yet.
My only last comment is, it's not heterogeneity, because that's usually the term that you use when you want to adjust and to control. I think it's context-specific policymaking and understanding context, and that's the richness of the work that you're doing. So having that understanding, and I appreciate that, Carolina, you have some other policies that you also wanting to bring in. I think that's the real added value. But again, thank you. It's very exciting stuff. And I would think, if you haven't mentioned anything about citizen science, but I would think in how you could use some of this information or engage, because I think in some other areas, like in pollution, there's been some very useful experimentation. And I think that could be also material for intervention studies, action research, that kind of thing. Thank you very much.
Thank you very much, Carlos. Thank you, Dario. Thank you, Carolina. Thank you, Alex. Thank you, Germán, for these very nice presentations and evidence from our region, from Latin America, that many other countries can learn from. There's a lot to learn from Latin America. So thank you very much.
Brava.
Thank you.
Thank you.